last Thursday, she was doing coughing and that thing.
Okay. Who's doing
And,
something? Go ahead.
she's my mother.
Okay.
So after Thursday, Friday was okay.
Okay.
Friday she was working, but
Okay.
then in the evening,
Okay.
she got fever.
Fever in the evening. Okay.
Yeah. And as we were aware that a week before that, all the symptoms came, she came in contact with 2 corona patients. So we were already aware that way. And so we just went for the test on Saturday and she came positive. Hello?
Okay. And she became positive.
Yeah, so on Friday she had the fever and then we gave a paracetamol. But after that she had fever on Thursday noon. So by then we started all that medicines and all given by the doctors.
Okay. What medicines has she been taking?
Medicines. I mean, I forwarded you one, but there was the other batch of medicines which we gave for 5 days.
Okay, give me a second. Let me see which medicines you forwarded. All right, so Predmet is 60 milligrams. Ecosprin, which is aspirin, 150. Raybomb is and vitamin C 500 and paracetamol. Okay.
Yeah, I can share you that medicine.
Yeah.
Yeah, I shared it.
Okay, on the group. I didn't get it. Okay, Pumachi, can you send that to me?
It was Azithro 500,
Good.
ivermectin,
Ivermectin, good.
zinc COVID, and vitamin and paracetamol.
Zinc, paracetamol, ivermectin. All right.
Yeah.
And she got azithro, you said. So that's 2 medicines. Ivermectin, I think, is also metabolized by the liver. Did we get a liver enzymes? I know you sent. Hold on, let me see. You sent me diagnostic panel. So
When one more medicine was there, that is just a second. Febiflu.
yeah, Fabiflu. So favipiravir.
Yeah, so it was given 4.5 for 2 times, and then it was given morning, evening 2.
Okay.
Yeah.
She got favipiravir. Is she feeling better now?
She was good. We completed the 5-day course on, I think, a day before yesterday, I suppose. And but yesterday whole day she was not having fever, but after evening, around evening, she had fever, and we went for this lungs test, X-ray.
Oh.
So the lungs X-rays, I shared that also. So it was like 9 out of 25 something.
Yeah.
So after that, it was yesterday night, and by today she was fine, not having cold, cough, or fever or anything. But there was this severe weakness. That's it.
Okay.
Hello.
Yeah, I'm looking. Okay. Is she doing the patch on the left arm and left wrist?
What is it?
Is she doing the left arm, left wrist patch? It's this patch that this Russian doctor has he's perfected from Ayurveda. It comes from Ayurveda.
Okay,
And
that some kada or something you call it.
no. There's a kata which I'll give you the website. It's on thebuytelemedicine.com, www.budai telemedicine.com. I'm just sending that to you. And you can take a look at that. But I'm looking at I'm just looking at her labs right now, and I do see that the X-ray just from the report. You didn't send me the actual X-ray, which is okay, but she's giving this the severity of 9 out of 25.
Yeah.
So the question is she having trouble breathing? What's her last saturation?
Breathing as such, she went for till now there was no issue with the breathing or coughing or anything, not even cold that way. But today she was complaining that after coming out from bath, she was just breathing a bit heavily, not like usual one. That's it. That was just for once. After that, the whole day she didn't complain anything else.
Okay. Is she on taking steroids?
No,
Does she have diabetes?
no, nothing, no issues.
What's her saturation? Do we have a pulse oximeter on her?
Yeah, we were constantly looking at her O2 level. So that was around 99, 98, and it was maintained almost every time, whole day.
The platelet count is good. Neutrophils are high. And she was just having some shortness of breath first time this morning, maybe some heavy breathing, but then it went away. Yeah.
Yeah, yeah.
Her white blood cell count is low.
Yeah, for that actually we started giving her those dates and dry fruits and other things like beetroot and carrots.
Hmm.
So that was highlighted by the doctors even. So we started working on it. And even she was given some hemoglobin or I think iron medicines, two of them.
Yeah. Low hemoglobin, low hematocrit. RBC is 3.4.04. Okay. And she's not having any trouble breathing. You said her saturation is okay now, but now she only had one episode this morning. And
Yeah.
any trouble walking?
No, not walking. Like she went for I mean, to the roof terrace today around morning.
Okay.
She was fine.
Okay. Can we see her walk? Do you mind turning on your video? Let's see her walk and examine her.
Okay, wait, I'll just. No, একটু হেঁটে দেখো না এখান থেকে। এই লাইট চলে?
Hello. Okay. Good. Good. Can she just, is she having trouble breathing?
এখন শ্বাসের প্রবলেম হয় না? না।
Any trouble walking? Sounds like there's no trouble walking, huh?
Yeah, there's no trouble walking.
Any trouble with headache? Little off balance, she's saying. She a little off balance?
এরকম করে ব্যথা হবে না। Okay, so she's saying, Ayusha?
Yeah. Tell me.
Yeah, she's saying that if she's trying to breathe heavily, then there is some trouble.
Okay. So I think we need to start her. She's not diabetic. What was her blood sugar?
Sorry?
What was her blood sugar?
Blood sugar, we didn't check, but she was not having diabetes or anything. We didn't check blood sugar or pressure.
We should check it, definitely. Check her blood
Mm-hmm.
sugar because
Okay.
that's always the way that you check is a hemoglobin A1C for checking for diabetes. Did we get that value or did I miss it?
Mm-hmm. As
She's
such, she don't have any record of sugar thing till now.
well,
But still, I'll just go and check after this call or something.
especially with Hare Krishna. There's a lot of sugar. There's a lot of sweetness in temples. So have to
Yeah, sure, sure, sure.
check. So let's make sure that that's checked, and then
Okay.
let's see.
But actually, there's this update that she was not having any problem breathing, but now she just complained that there's a problem. So
Yeah,
this is just the update.
I think we need to start her on some prednisone tablets.
Mm-hmm.
Um, I'd like her to start on prednisone. Maybe start on 20 milligrams twice per day,
Okay.
prednisone, and then she also needs. What's her main doctor? We need to talk to her main doctor to do this.
There's a devotee only, Dr. Sachi Sut Pro.
Dr. Sachi Sud, can you ask him to please join?
I don't know if he's available at this moment or not because even he's running a bit busy.
Let me call him.
Mm,
Can I call him or no? If not, that's
uh,
then I'll just give my recommendations. I have
okay.
two major recommendations.
Hmm.
Number one is I'm concerned about this breathing. Number two, I felt that when she was walking, she may have been a little bit off balance.
Okay. Okay.
Can we just see her walk again? Can I just see her walk one more time? Because maybe I didn't evaluate because the camera's a little bit far away. But when she was stopping, she had to stop herself from walking. A little subtle.
Okay. Okay. I'll ask her. Ma, আবার হেঁটে দেখাতে বলছে। নর্মাল এখান থেকে এখানে হাঁটো না। এটা হেঁটে দিয়ে আসো। তোমার হাঁটতে প্রবলেম হচ্ছে তো না?
Okay, never mind. She's not off balance. She's not off balance. Okay. All right, perfect. Okay, you can shut the door and do this. So I have two recommendations. Have you heard of Ayurveda medication?
Are
Have you?
you?
Yeah, Ayurveda Advance.
Okay. No, I didn't hear it.
Okay, have you heard of the kata that we've talked about?
Yeah. Yeah.
Okay, so the kata is on DubaiTelemedicine.com. Ayurveda Advance. I want her to get advanced tonight. She should take this medication. This medicine. This is what it is.
Okay. Okay.
I want her to take it. I think she should, because we have some good reviews. It's not something that is. Um, uh, it's not something that's absolutely proven, and it's in this testing sort of state, but it's approved by Ahmedabad, especially in Gujarat. It's approved in
Okay.
Gujarat. So we should absolutely explore taking it, and she should get it tonight. So I'm going to send you the number of him, and I'm going to send him the video of what's going on because she's having breathing difficulty. In
Yeah.
addition to that, I want her. I mean, because she's in a place with good hospitals. How far are you from Vadodara?
It's just 100 kilometers from here.
Oh, that's a little far. Okay, and then let's see what hospital. The hospital I'm affiliated with there is. Let's see. Let me take a look. I can't. What hospital is close to you there that you guys like? Do you like hospital? Do you have a hospital that you like there?
Yeah, we have multiple hospitals, but actually, the hospitals are maximum full.
No, I have a good relationship with one hospital there.
Okay, you can share me the details then.
Yeah, I just need to know how far it is away from you, because I don't know the geography as well.
What's the name?
Um,
Okay, by noon she was not having this breathing problem,
yeah,
but She's saying that she's not able to breathe. And even there was some problem with the speech also, like she was not able to talk much.
Okay, how far is Shakti Rupa Hospital from you?
I'll check. Shakti Rupa.
Maybe these are too far from you. I'm not sure. Anyway, so Vadodara is 100 kilometers, so that's a little far. So my issue with the breathing is that
Oh,
we want her to breathe.
okay.
Okay, so a good way to get her to breathe is to put her on steroids. I think that she should be on steroids early rather than later, is what I believe. The second thing is that inhaled steroids is also a good thing. Okay,
Mm-hmm.
so number one is prednisone. Number two is inhaled steroids. Number three is she needs the Ayurveda therapy. So talk to her doctor about these, her primary care physician about these three things. Prednisone,
Okay.
so prednisone, 20
And
milligrams,
steroids.
steroids, inhaled, like she needs an inhaler or an inhaled nebulizer, actually, nebulized steroids,
Okay.
like budesonide.
Mm-hmm.
Okay, and then the next thing is Ayurveda therapy. Okay.
Okay.
So we need to, is the Ayurveda therapy. So I'll send you the guy for Ayurveda therapy. If you look on the Buy Telemedicine, can I share my screen? Let me show you. On the Buy Telemedicine, I'm going to share my screen. Um, and tonight it's 7:30.
Yeah.
Don't wait. Get this done tonight. Okay.
Okay. I'll talk to my physician and then we'll work on it.
Yeah.
So I mean, do she need to get hospitalized or
No,
anything?
no, not right now. I don't believe because she's satting. What's her saturation? Is what 98, 99?
Yeah, I think we should check the O2 now.
Yeah, just check.
ये बोला था ना?
Just go check it and then tell me while I'm online.
I- No, oximeter पे check करो ना. Yeah, so I'll start working on the points you gave, 6 points.
Yes.
Five, sorry.
All right. So let me just trying to pull up this.
Okay, the oxygen is 98. Still, it's 98.
That's fine. Good.
Okay.
So here you go. Let me go to your courses. And let's go here to. All right. So right here, can you see my screen?
Yeah, yeah.
Okay, so it's thebuytelemedicine.com is the actual URL. But right here, there's a video. If you go to that site, and I'll just put this on the group.
Okay.
Right here is a video from this. I would advance and maintain
Mm-hmm.
this video. Right here, this is an interview I did with the makers of this medicine. About
Okay.
an hour video, an hour long video. It's pretty boring, but it tells you everything that's important. This personality here, he created this video or this
Okay.
medication, and he's done it from some years of research. I don't think that he has a great amount of publications, but people are saying that his medication works, and and so, but also at the same time, I just took his medicine on Sunday. I didn't have COVID-19, but I took
Mm-hmm.
it on Sunday with the kata and all that kind of stuff. I was feeling totally low, and I felt a burst of energy. So
Okay.
there's some energy that's there. Maybe it's because of the sugar, maybe not, but I felt like it was okay. So
Mm-hmm.
and there's a lot of people, like over 100 people in Mayapur that are taking the medication also, and then it's also being distributed in the U.S. People are taking it in the U.S. also.
Okay.
So from what I understand from him and his website and whatnot, and I know people are taking
Okay.
it. So I'm doing a survey on after people take the medication. I'm doing a survey, and I think the side effects from the medication are GI side effects that you can get some heartburn. So tell her that she should take it with food,
Mhm.
medication. That's number one. Number two is she should take the prednisone, probably 10 to 20 milligrams twice per day. Number three,
Okay.
number three, she needs liver function tests. We need to test her liver because she's on favipiravir, ivermectin, and she's on azithromycin. All three of those medicines affect the liver. So
Okay.
you have
At
to.
this moment, she's on this medicine.
What's that?
She's on like after the I gave you this azithromycin and they were just for 5 days. Now she's referring to this medicine.
Okay. Yeah.
Uh, pred-
Azithromycin still stays in the bloodstream for like 10 to 15 days
okay.
because it's got some long acting component in it. So
Mm-hmm.
So those are the three things. So I would uh, I would definitely get her liver functions tested. I would definitely do the prednisone. I would do iode therapy. You should take the you should log into the course and you should watch all the videos uh,
Mm-hmm.
for the patch therapy and for the kata. Those are the five things. Okay.
Okay. Okay. So I just had a question that 9 out of 25, that score, what does that signifies?
So it's a good question. So it's not at a high level of risk. Okay, it's at a mild to moderate level of risk is 9 out of 25. But the
Okay.
problem is this: is that this if you're already at that 9 out of 25, this can progress. It's not just that the 9 out of 25 is just a static number. Are you
Mm-hmm.
are you in, you're out of you just finished college? Yeah.
Yeah.
Okay. So what that means is not a static number. So it's getting it could get worse.
Okay. Okay. So how many, like, I mean, how much time it will take to get worse?
So the issue is that if we get her steroids right now, most likely she won't have a problem of getting worse because what steroids do is they calm down that system to stop the inflammation.
Okay.
When you don't give steroids, especially this has been in my experience, when you don't give steroids early, what happens is I feel that patients do get worse. Okay.
Okay.
So I feel that that should be there. So we use IV dexamethasone. We usually give an IV of dexamethasone. But at this point with 99, it may not be worthwhile, but at least give her oral steroids. If she starts to get worse, it can be tomorrow or day after. If she starts to get worse, then she want to consider IV dexamethasone. But if she does both the inhaled steroids and the other steroids, she might just be on steroids for 1 or 2 or 3 days and get over with it without a problem. Right now, she might get away with it without doing any steroids at all, but I feel that it's a risk to not start steroids, especially in a healthy lady.
Yeah. So like there is no symptom as such. Like she's not having diarrhea or acidity or anything at this moment. Though she was having it 2 days back, but today she's not having any other symptoms than weakness up till now. Now she's feeling this breathlessness and all.
Yeah, breathlessness. Yeah, breathlessness is not good.
Mm-hmm. But that was like when she was trying to get on stairs or something, like when she was doing some movement, that time she was getting a bit weaker or something like that.
Yeah, if she's, I would still start on steroids if she's feeling that sensation of getting out of the shower and
Mm-hmm.
feeling uh, breathless. It's something that you want to pay attention to. In my experience, that gets worse before it gets better.
Okay, 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 right. So
Okay,
you still don't recommend to go for hospital or anything. We can cure at home.
I'm recommending hospitalization, but obviously very frequent checks. And then I would definitely talk to your doctor and then get him to approve. do whatever he says. He may disagree with me on starting the steroids, but I would definitely start the Ayurveda and go from there. But ask your doctor directly. Should I do the prednisone and whatnot? That's my recommendation.
Okay, okay. I'll talk to him. If he's available, then we can talk. I mean, we can have a call with him.
Yeah, absolutely. Absolutely. And you can get me on the line to speak with him, and I can just tell him what my experience is. I think I've spoken with him before. He's a very good doctor. So,
Okay, okay. Fine.
okay.
Okay, Prabhu. Yeah, yes, Prabhu.
Okay. Then let's.
Okay, thank you. Hare Krishna.